Hello, everyone. Hello. Welcome to the webinar called Nutrition During and After Cancer Treatment, Fighting Cancer with Your Fort. I'm Megan Claire Chase, the Breast Cancer Program Director.
And I'm Maggie Nicholas Alexander, SHARE Senior Director of Gynecologic Cancer Patient Support and Education at SHARE.
So before the presentation begins, I'd like to tell you a little bit about SHARE. We're a national nonprofit that supports, educates, and empowers anyone who has been diagnosed with breast or gynecologic cancers and provides outreach to the general public about the signs and symptoms, because no one should have to face breast, ovarian, uterine, cervical, or metastatic breast cancer alone. For more information about upcoming webinars, support groups, and our helplines, please visit our website at sharecancersupport.org. And we would also like to thank Savor Health for their partnership on this program.
We also have a few housekeeping reminders for you. All participants will be muted during the presentation. Once the speaker finishes presenting, we'll begin the Q&A discussion. Feel free to ask any questions through the Q&A section at the bottom of your screen. For those watching on Facebook Live, feel free to write in the comments if you have any questions. Remember that Chelsey is unable to give specific medical advice, so please keep your questions general in nature. We also have closed captioning available. You can enable this feature by clicking the live transcript button on the bottom of the screen and selecting the subtitle option.
This webinar is being recorded. We'll share the recording in a few weeks with all the registrants, and it will also be added to our website. So now I'd like to hand it over to today's speaker, Chelsey. The screen is yours.
Awesome. I will share my screen right now. Does that look okay, team?
Perfect.
Awesome. Thank you so much, Chair, for having me today. I am Chelsey Schneider, the Head of Clinical Evidence and Advocacy Relations with Savor Health. I'm so pleased and honored to be here today to talk to you about nutrition during and after treatment and share information on Savor Health's partnership with SHARE and how we offer our technology, Ina, a dietitian-on-demand. We know that nutrition information can be very confusing and always seems to be changing. So I will talk through nutrition during and after treatment, go through some hot topics, talk about our partnership and our technology, Ina, and then I'm happy to answer any questions that anyone has. Okay, so I'd like to start out by highlighting the importance of nutrition at various phases during someone's cancer journey. So here I've broken down the various phases of a cancer journey into three parts. First, the diagnosis, then during treatment and after treatment. And nutrition is very, very important throughout all of these different phases, wherever you are in your journey. Nutrition plays a really key role in each phase. Just like people say, food really is medicine. So at the time of diagnosis, it is estimated that over 50% of cancer patients are at risk for malnutrition. So even before you receive maybe a treatment plan or a complete diagnosis, you might already be experiencing some nutritional challenges. It's really common. Early screening for signs of malnutrition is very important and should be part of any cancer center's procedures. Early screening would help healthcare professionals recognize signs of malnutrition, for example, before someone has lost a significant amount of weight or before their appetite significantly decreases. So catching these things early on is really important. This early detection of nutrition challenges or malnutrition risk can lead to early intervention by dietitians who work with patients to create individualized nutrition care plans. If available on your team, I recommend that all patients advocate to meet with a dietitian, even upon diagnosis, to get advice on what to expect and how they can intervene during their treatment and get a specific individualized nutrition care plan based on your diagnosis and your treatment and your food preferences and all of these things that factor into what you should be eating and what's appropriate for you. Dietitians can really provide that tailored education based on a number of those factors. If you're currently on treatment, nutrition plays a very, very big role here as well. I'll talk about this a little bit more on the next slide, but about 90% of cancer patients already have addressable nutrition symptoms when they are starting treatment. Symptom management is one of the most important concerns for cancer patients and caregivers. So how can we help manage these symptoms through dietary intervention, through nutrition? What we eat can really help with managing symptoms like nausea, oral changes, constipation or diarrhea, even having a combination of both. We know that women with cancer face many, many different types of symptoms based on their treatments, and nutrition can really help with this. Registered dietitians can help to address each of these symptoms by providing recommendations on foods to eat, foods to avoid either temporarily or for a little while if you're having ongoing symptoms during treatment, different recipes that are appropriate to try, and so much more. Research shows that cancer patients receiving nutrition support have a significant reduction in the occurrence and severity of symptoms. And if patients are managing their symptoms, they will be able to adhere to their treatment better, which helps to improve outcomes. So just one of the many reasons why nutrition is so important and why symptom management is so important. Along with the treatment recommended by your medical team, like anti-nausea medication or a mouthwash to help if you're having oral changes, nutrition can really, really help with the symptom management piece while you're on treatment, or even after treatment if you're having any lingering side effects, which is common. If you are in the after treatment phase, if you're finished with surgery, chemo, radiation, maybe you're on more of like a maintenance therapy type of treatment plan, it's important at that point, once you're, feeling really good, symptoms have subsided, hopefully, that you focus on kind of what we call the survivorship phase. So following a mostly plant-based diet. I'll talk more about this in a little bit, but plant-based diets are known to help reduce recurrence and prevent many types of cancer. So we want to learn about what plant-based diets are, how we can exercise, limiting SSB, which stands for sugar sweetened beverages, processed meats, foods high in fat, and achieving a healthy body weight if that's possible. So I'll talk a little bit more about each of these recommendations in a few moments. So as you can see, nutrition plays a role in all of these different phases as you are on your cancer journey. I want to talk a little bit about what an oncology dietitian is. So an oncology dietitian is a registered dietitian who has 2 years of working experience as a dietitian, 2,000 working hours with oncology patients, and who has passed a board exam to certify as a CSO, a certified specialist in oncology. Every 5 years, oncology dietitians have to recertify this exam, which really highlights the importance of, in our field, staying up to date with current treatments and all of the research that always is coming out about what is beneficial or what should be avoided for cancer patients. And again, just really staying up to date on all of the different treatment regimens and drugs that are out there. So every 5 years, oncology dietitians recertify and the test changes to reflect the current research and evidence. At the moment, there is about one dietitian for every 2,700 cancer patients, which is a crazy ratio. And one of Savor Health's motivations behind creating Ina, our Dietitian-on-Demand, to help bridge that access gap, because there is not enough oncology dietitians for all of the patients who really would benefit from nutrition knowledge. And Ina, our Dietitian-on-Demand, can help anyone, any patient, any caregiver, wherever they are, whenever they need it, with any nutrition concerns that they have. So I just wanted to talk a little bit about nutrition during treatment. Based upon your diagnosis and your treatment regimen, you might experience different side effects. However, some common side effects that many women face are fatigue, oral changes, early satiety, and/or bloating. Early satiety is feeling very full when you've only eaten a small portion, nausea or vomiting, or both, and constipation or diarrhea, or possibly a combination of both. So nutrition can help with each of these side effects. A few tips that I'd like to share, and our technology Ina can share a lot more interventions about this, but with fatigue, is having a meal plan in place can really help. So having some super simple to prepare or already prepared foods on hand when you're feeling tired, but you know your body needs that support of nutrition and energy. So having maybe things like microwavable oatmeal with nuts and seeds, yogurts, pre-cooked hard-boiled eggs, maybe some frozen items like frozen fruits or frozen vegetables that can be cooked really quickly, frozen grains that can be popped on the stove or in the microwave and don't require hours of cooking. So having a little bit of a meal plan, a game plan in place that a dietitian can help you to create can really help you prepare if you're feeling fatigued during treatment. Oral changes are also common and come in many different forms. So some patients experience dry mouth, mouth sores, taste changes such as metallic taste, a loss of taste, hyperglusia, which is what we say when foods that are sweet taste very, very sweet, or foods that are salty taste very, very salty. So nutrition interventions can help with managing these side effects. One is that you can alter the taste of your food to help with these symptoms. If you're experiencing a metallic taste, avoiding metal utensils can help. Sometimes using a little bit of an acidic flavor, like a lemon juice or a vinegar, or a little bit of a sweeter flavor, like a maple syrup, can help. So working with a dietitian to receive modifications or asking Ina for tips based upon any oral changes that you're having. Early satiety and bloating is very, very common in this population. So we know that many of our women face this symptom. With early satiety, it's really important to keep your meals small, but more frequent than normal. So having a small portion, but trying to eat every, let's say, 3 hours instead of maybe every 5 or 6 hours. If you're experiencing bloating, eliminating any gassy foods from your diet, cooking foods until they're soft, blenderizing foods like pureed soups with vegetables or smoothies, and really eliminating anything with seeds or skins, or, like I said, those gassy foods from your diet. With nausea and vomiting, there are so many nutrition interventions that can help. One of which we were just speaking about behind the scenes was ginger. So ginger tea is on this slide as one of the really great nutrition interventions that we can use if you're experiencing nausea. So ginger in the form of tea. Some people really enjoy ginger chews or ginger cookies. That could be eaten with something like yogurt as a little snack to have if you're feeling nauseous, but something that can settle your stomach. Constipation and diarrhea is also a really common side effect are both really common side effects to face during treatment. And sometimes it's a mixture of both. On Monday, feeling constipation, and then on Tuesday, Wednesday, having a looser stool or diarrhea. So really working with your medical team, a dietitian, asking Ina for help with what you can do to help manage these symptoms. With both constipation and diarrhea, hydration is so important and sometimes forgotten. So whether we're increasing the fiber in our diet to help manage constipation, we definitely want to drink more water. If we are even limiting the amount of fiber that we're eating to help manage diarrhea and kind of omitting fresh vegetables and fresh fruits for the time being while we're managing diarrhea, we also really want to increase hydration, especially hydration with electrolytes to prevent from becoming dehydrated. So just a few interventions that can help with these side effects, and Ina has many, many other interventions and also recipes that can help you manage these side effects if you don't know what to eat, what to buy, what to shop for, and what to cook. So the American Institute for Cancer Research is a really amazing resource that provides evidence-based guidelines on cancer prevention. I put the first few recommendations in green because those are the things we want to focus on increasing in the diet, or the positive actions we can take. And in red are the things we want to be cautious of, maybe things we want to limit in our diet and possibly eliminate. So the AICR guidelines are to be a healthy body weight if that's achievable, to exercise and be physically active. We know that physical activity can help to prevent cancer and cancer recurrence, to eat a plant-based diet rich in whole grains, vegetables, fruits, and plant-based proteins. So not necessarily meaning that you have to fully become vegetarian or vegan, but eating more plant-based foods in your diet is extremely beneficial. Limiting fast foods, foods that are high in sugar and refined grains. Limiting red and processed meats. Red meat can be eaten in less than 12 to 18 ounces of cooked red meat per week. So if we think about what that really means, a portion of red meat is about the size of your palm, maybe a tiny bit bigger. So 3 or 4 small portions per week would be about 12 to 18 ounces. So we want to stay under that threshold, and then we can safely include red meat in the diet. With processed meats, there is unfortunately no limit like there is with red meat. So we really want to try to find healthier replacements for those in our diets, or eat them on super, super special occasions once in a blue moon. Limiting sugar sweetened beverages like sodas, juices, or any sugary drinks. Limiting alcohol in the diet, and not using supplements for cancer prevention. We'll talk about this more in a little bit. The AICR also has an amazing database of cancer fighting foods. And I don't always love this term because sometimes it can be used to kind of pull you into something that might not necessarily be evidence-based research, but everything on the AICR is evidence-based human guidelines, human research-based information. So these truly are foods that are known to fight cancer. And you can see all of the amazing colors on the screen. So apples and asparagus, blueberries, all of the green vegetables and fruits, grapes, kale, cruciferous vegetables, Brussels sprouts. Coffee is on here, which is always something that catches people's attention. Coffee certainly has cancer fighting benefits. It's usually what goes into the coffee, like sugary sweeteners or other things that can maybe make coffee drinks not as healthy. Flax seeds, raspberries, pulses, all of those beans and peas and legumes. Garlic is on here as well. And then a few more on the next page. soy, which we'll definitely talk about, spinach, all the different types of squashes, strawberries, tea, which is another great beverage to include in your diet, but also like we talk about with the coffee, really important to know what sweeteners or sugars you're using in your tea, whole grains and nuts like walnuts and tomatoes as well. So hopefully you can take a look at these two slides and maybe pick one or two foods that you like, you're not sure if you like, and think about how you can incorporate them into your diet, just to include more of those really beneficial cancer fighting foods into your routine. Okay, so now I'm going to talk about some hot topics and we'll do a little bit of a myth busting exercise. So my first myth is that organic foods are always healthier. Do we think this is a fact or a myth? Everyone can think for a second. And the answer is this is a myth. Currently, there is no convincing evidence that shows a difference between organic and conventionally grown foods related to someone's risk for developing cancer or cancer recurrence. So even on conventionally grown products, the pesticide level is pretty low and generally safe for people to eat. At the same time, there is conventional wisdom that would tell us it's probably not a good idea to eat tons of pesticides. So we should always be washing our produce well, whether it's organic or not, which does remove some of that surface pesticide residue. And if it is accessible and affordable to you, you can consider buying certain foods organic if that's something you'd like to prioritize in your diet. Organic does not necessarily mean that it's healthy. So if you see a cookie or a packaged product in the grocery store that says organic on it, don't automatically assume that it's healthy. We really have to be a nutrition detective here and think about why is this product being called organic or not. So as stated on the bottom of this slide, the advantages of eating a variety of vegetables and fruits strongly outweighs any risks from pesticides. So if you are not able to buy organic foods, if it's not affordable or available for you, the benefits of eating those plant-based foods, even if they're conventionally grown, strongly outweigh the risk of, eating a conventional produce item versus something that is organic. So we always want to prioritize just eating a good quantity of fruits and vegetables is the bottom line. However, if you are able to, if it's, like I said, accessible, affordable, we can use the environmental working group, Dirty Dozen and Clean 15, which they put out every year, which is a list of the 12 fruits and vegetables that have the highest level of pesticides and the 15 fruits and vegetables that have the lowest amount of pesticides. So things that we don't necessarily need to buy organic. So this year for 2023 on the Dirty Dozen is strawberries, spinach, kale, collard, and mustard greens, peaches, pears, nectarines, apples, grapes, bell and hot peppers, cherries, blueberries, and green beans. So you can kind of see a common theme here is sometimes things that have really thin skins like berries and spinach, which has no skin, and other greens can absorb more pesticides. So even if you don't have this information and you're walking through the grocery store, if something has a thin skin and you're able to get it organic, that might be a better choice than investing in something like a banana or an avocado, which has a really thick skin. And you're taking off anyway. So whether you have this information or whether you're just using a practical approach as you go through the grocery store, either one works. And like I said, at the end of the day, we just want to focus on a diet that's rich in fruits and vegetables, whether they are organic or conventional. Okay, the next myth, and certainly one of the hottest topics, is that sugar feeds cancer and we should absolutely avoid it at all costs. So I really hope that everyone knows that this is a myth. So I'm going to break down a little bit of the science behind this. So sugar, when we eat sugar in any form, breaks down into a small molecule called glucose, which acts as fuel for all of our cells in our body. Cancer cells are very fast dividing cells, so they end up using a lot of energy and a lot of glucose. But all of our cells need glucose to function. It's the primary source of energy for our body. So even if we were to avoid all of the glucose or sugar in our diet, our body would have to find another way to create glucose so that our organs could function. So if we avoided all types of sugar in the diet, our body would break down other things like fats or protein to help create glucose so that our body could function. We don't want our body to go into this kind of survival mode or breakdown mode and start breaking down protein, especially when we're undergoing cancer treatment. So it is not beneficial to try to avoid all forms of sugar or carbohydrates, which break down into sugar in our diet. So what we want to do is really focus on complex carbohydrates and foods that naturally contain sugar. Complex carbohydrates naturally contain fiber, and that's really the healthy way to approach this. We do know that some people who have diets that are very, very high in sugar over a long period of time, so for many, many, many years, might experience high blood sugar levels, which can increase insulin levels and cause the body to be in a pro-inflammatory state. And that possibly, as well as the link with being overweight or obese from eating a high sugar diet, can increase your risk of cancer. So there is a link, but in a very, complicated way. We want to focus on, like I said, eating those complex carbohydrates and not trying to eliminate all sources of carbohydrates or sugar from the diet. So for the bottom line, all people should strive to limit foods that have added sugars and things like sugar sweetened beverages. So now we can look at nutrition labels and see how much added sugars foods have and how much maybe natural carbohydrates it has. And that's a way to help decipher if something is a complex carbohydrate or if it's something that maybe has a lot of added sugar that we could eliminate from the diet. Always focusing on foods that have natural sugars like fruits, vegetables, which have a lot of fiber, water, antioxidants, and other beneficial nutrients. If you are someone who has to pay attention to your blood sugar, maybe on steroids or treatment, if you have a history of prediabetes or you're diabetic, it's important to pair high carbohydrate foods with protein and fats to help decrease the blood sugar spikes. And just enjoying sweets in moderation. So the best approach is to not cut any major food group out of your diet, but really to eat things in moderation, enjoy things in moderation, and focus on those complex, high fiber carbohydrates, natural fruits. Okay, another hot topic that I touched on before, which is one of the AICR recommendations, is I need supplements to stay healthy. In general, we're going to classify this as a probably not, so as a myth. Of course, if you are taking a supplement that was recommended by your medical team, for example, vitamin D or calcium, maybe iron that is prescribed, that's a completely different story. However, supplements such as isolated parts of foods, like for instance, maybe green tea extract or a mushroom extract, high doses of antioxidants like vitamin C should generally not be taken as part of your treatment plan in efforts to help prevent recurrence of cancer. We always want to focus on the whole food form of things. So you cannot get all of the protective benefits linked to eating a whole food by isolating it into a supplement. So when we have, a polyphenol type of vitamin, maybe something that was isolated from grapes. We don't get all of that fiber, all of the other beneficial nutrients that you get when you eat the whole food. We also risk for certain side effects. Some supplements can upset your stomach, some can cause platelets to decrease, which can put you at risk for blood thinning. Some can interfere with chemotherapy, radiation therapy, and a number of other different side effects. So we really want to focus on the whole food forms, the whole food types of foods to get all of our vitamins and antioxidants. Of course, like I said, there are those exceptions, like if you're following a vegan diet, focusing on supplementing with B12, as B12 is primarily found in animal foods. If you've had a extensive GI surgery, you might require some form of supplements. But in general, we're going to steer clear of taking supplements unless it's specifically been reviewed and recommended by your medical team. So I just want to talk a little bit, now that we went through these myths, about just being a little bit of a nutrition detective. So don't always believe everything you hear or read. Something that's appropriate, excuse me, for someone else might not be appropriate for you due to your medical history, your treatment, your side effects, or your nutrition needs. So you can always consult your doctor, your nurse, a dietitian before making any changes, taking any supplements, and also always try to reach out to Ina, which is the Intelligent Nutrition Assistant, for support with any questions that you might have. Okay, so I'm going to talk a little bit about Ina. Ina is the Intelligent Nutrition Assistant. Ina provides personalized evidence-based nutrition interventions 24/7 to help cancer patients and caregivers manage symptoms using their smartphone via SMS text. So you can ask Ina for help with managing side effects. For example, I'm having mouth sores, what can I eat? Or I'm having nausea, can you send me a breakfast recipe? Ina can help you with interventions and recipes to help manage any side effects of treatment that you're experiencing, or to answer any questions that you have on anything related to chronic disease management or these hot topics that we were talking about today. So Ina can be used by patients, caregivers, or healthcare professionals, and it can be accessed through the resource page on the SHARE website, which I'll show you on the next slide. Excuse me. There is no password or login needed. All you have to do is put in your phone number and register for the service, and Ina will text you right away to get started. So Ina is an AI-based platform, so it is not a live dietitian, but it's meant to replicate the process of meeting with a dietitian, as Ina takes into consideration your diagnosis, your treatment, your symptoms, your food preferences, all of the information that a dietitian would take into their brain to, create the appropriate interventions that would be best for you based upon your specific needs and treatment plan. There is no cost to access this service through our partnership with SHARE, and Ina has over 75,000 evidence-based interventions currently. So she can answer any questions that you have related to oncology, nutrition, and chronic disease management. This is just what it looks like when you go on the SHARE website and click additional resources. You can find the Ina page. And as you see here, you just put in your cell phone number to register for the platform. And everything is done over SMS text, which is really nice because you can ask Ina for questions wherever you are, whenever you need it. Okay, here's also the link and the URL to sign up if you're interested. And I want to thank everyone at SHARE for inviting me to speak today. And I think we have plenty of time for hopefully some good questions.
Thank you so much, Chelsey. That was an excellent presentation, and we do have a lot of time for Q&A, which is awesome.
Great.
So yeah, let's begin the Q&A. You can still submit questions in the Q&A section at the bottom of the screen. We will try to get through all of the submitted questions, but we may not be able to due to time constraints. So, all right, so this, we talked a lot about the benefits of plant-based diets. So I think this question is really good. And they're asking, are plant-based products like Beyond Burgers actually healthy, or are they so processed that they are actually bad for your health?
That's a great question, and really important that we're kicking off with this question because we did not get to talk about soy, which is very important. So many of those types of products are made with processed soy foods and processed soy ingredients, which is not currently recommended. So something like a Beyond Burger is usually made from processed forms of soy protein powders, which we don't want to include in the diet. However, the evidence does state that fresh and whole soy foods are actually beneficial to be part of your diet if that's something that you like to eat, and that falls under that category of plant-based protein, which we were just talking about. So incorporating whole forms of soy like tofu, tempeh is another one, edamame, which is really yummy. Miso is another form of that. So it's certainly okay and safe to eat those fresh forms of soy and limit any really processed form of soy that might be found in something like a Beyond Burger, maybe something like a soy protein powder or a protein bar that's made from soy protein.
I kind of want to keep on that topic of soy. We have a lot of questions about that. So what do you recommend, or how do you recommend addressing soy and dairy with those who had estrogen and hormone-driven cancers? Because we're always hearing, don't have any soy, but then it's like, how do you read that? What should we be thinking about?
Yeah, those are two great questions. So I kind of want to separate soy and dairy. Overall, both are totally fine and safe to eat. Like we were just talking about with soy, it's really just focusing on the quality of the product that you're buying. So limiting that processed soy food, and eating that whole soy food. Whole soy foods actually contain phytoestrogens, which sounds scary when you have an estrogen-driven cancer. However, a lot of the research shows us that those phytoestrogens can block the bad estrogen from the receptors on the cancer cells and actually prevent the bad estrogen from binding. So this is why the current recommendations say that you can eat soy and it's actually beneficial and might reduce your risk of recurrence. So it's certainly fine, safe, and even recommended to have those whole soy foods, even though they contain phytoestrogens. With dairy, it is recommended to have mostly non-fat and low-fat dairy foods. We know that one of the things in dairy that might be linked to a risk of certain types of cancer is the high amount of saturated fats that's found in full-fat dairy. So the current recommendation is to choose low-fat and non-fat sources of dairy, and they're certainly fine and safe and healthy to include in your diet. There really are no hormones found in dairy foods, but if this is something that makes you feel better, you could always choose an organic product, which we know has just, the best type of ingredients. So an organic type of low fat or non-fat milk would be a great choice. Great questions.
Yeah, there's so many good questions coming in. All right, so what are your thoughts on using protein powder or protein drinks?
Yeah, so protein powder and protein drinks can certainly be beneficial. Um, if you're currently undergoing treatment, chemo, radiation, preparing for surgery, or after surgery, it's likely that your protein needs are elevated compared to normal. So protein powders can certainly help many patients get in that extra 20, 30 grams of protein that they need if they're already eating a lot of protein in their diet and just want to get that extra amount. Sometimes patients are facing side effects like, like we said, mouth sores or loss of appetite, and protein powders or protein drinks can be really beneficial there as well. So certainly helpful and healthy, just again, avoiding that soy protein powder, and choosing maybe a different type of plant-based protein powder or a whey-based protein powder as a supplement in your diet.
We often talk about how to be at a healthy weight, right? But what about, those patients where they've had a recurrence and they're struggling to actually gain weight, to keep weight on? What are some recommendations that you have for them to put on some weight in a healthy way?
Yeah, that's a great question. So maintaining a healthy weight and kind of preventing unintentional weight loss is one of the most important things that you can do if you're on cancer treatment. When cancer patients lose weight, they're really prone to losing that muscle mass, that protein store in the body, which is what we want to prevent. So really increasing the amount of healthy fats in your diet is one way that you could do that. So focusing on nuts, nut butters and seeds, healthy peanut butter, almond butter. You can add that to yogurt, toast, smoothies, oatmeal for an extra, addition of healthy fats. You can use olives and olive oil, avocado and avocado oil. Sources of healthy fats and things like tuna and salmon have a lot of healthy fats. So if you're looking for protein in the diet, those also contain healthy fats, as opposed to maybe eating something like chicken or turkey, which is great protein, but not a lot of healthy fats. And then at the end of the day, if someone's really focused on maintaining weight and preventing weight loss, it's also okay to eat foods that aren't necessarily healthy fats, and liberalize your diet in that moment. We often talk to our patients about prioritizing different goals based on where they are at in their treatment. So if someone's struggling with their appetite and losing weight, and they really like to have a little dessert at night or something that maybe has a little bit more fat or sugar, they should be eating that to help keep up their weight, and prevent weight loss within the context of an otherwise healthy diet. So it's all about the balance and the goals.
I really appreciate that answer. Thank you. And so we're getting some questions about like other forms of protein, like chicken, eggs, turkey, seafood. Could you sort of talk about those and whether those are healthy forms of protein to eat?
Yeah, so all of those are healthy and definitely have a place even in the plant-based diet. So I touched on this a little bit before. A plant-based diet does not mean you have to become vegetarian or vegan, but it means including more plant-based foods in the diet. So that does leave room for our sources of animal protein. And protein's really, really important when we're undergoing treatment. So people should still be eating things like eggs, chicken breast, turkey breast. I think chickpeas were mentioned. Chickpeas are plant-based protein. And then with regards to animal protein, I talked about the guidelines of eating red meat within that quantity that I mentioned, and not having too many processed meats as part of the diet. So we can kind of think of it as like a pyramid approach, like all the plant-based proteins at the diet, the other animal proteins, and then red meat at the top.
And what about seafood as well?
Yes.
Okay.
Seafood. So seafood is a great source of protein. Like I was just talking about, many types of seafood have that omega-3 fatty acid. So a lot of healthy fats, good for inflammation and for helping with adding calories if we need that as part of our diet. If you're actively undergoing treatment, it's possible that your immune system can be compromised. So we want to choose any forms of seafood or fish that is fully cooked. That's really the only caveat to eating seafood in the diet. Otherwise, it's certainly healthy.
We're getting some questions of people wanting you to show that slide about post-surgery. It was kind of near the end.
See if I could go back. Post-surgery.
There might have been something in there, maybe it was something you said about what should we, if we've had surgeries, what are some things that we could be eating to actually help gain some strength? So it might have been like, yeah, before, during, and after treatment.
Yeah.
Yeah. If you could just elaborate a little bit more on, when we've had surgery, our bodies are pretty weak, and it can be really hard to even want to eat. How do we eat in a way that will help give us strength? And then how can we continue that once we start moving into the different phases of our healing?
Yeah, that's a great question. So after surgery, it's really common to have a significantly decreased appetite. Some tips that can help are having small but frequent meals. So really changing the normal portion of what a meal would be and cutting it in half or even making it a little bit smaller than that. And knowing that it's okay just to have a small portion, but trying to motivate yourself or stick to a schedule to eat more frequently than we normally would. So instead of having the traditional like 3 meals a day, having a small snack every 3 or 4 hours can be really, really helpful. Even just visually, like if your appetite is not great and you see a small portion on the plate, you're more likely to motivate yourself to eat that rather than plating a big portion of food and saying, I'm not hungry, I'm struggling with my appetite. This is just not interesting me right now. So keeping the portion small, but trying to motivate yourself to do it more frequently. Also prioritizing protein in your meals after surgery is super important. So if you have a plate that has multiple options on it, always try to eat the protein part of the meal first, and then maybe go on to the carbohydrate part of the meal or vegetable part of the meal, because protein is really going to help support the body after surgery and help give you that energy that you need.
Great, thank you. And so we're getting a question about intermittent fasting, and what are your thoughts on that?
Yeah, that's a great question and another hot topic that we have not touched
It
on
certainly
today.
is.
Yeah, there's actually a lot of research that's coming out with different treatment regimens and if fasting is beneficial. The really tough part about kind of analyzing and interpreting this research is there's so many different ways to define what fasting is. So some people are doing a 12-hour overnight fast, which might be someone's like normal routine. Other people are doing more extended fast, like 18-hour fast. So it's hard to kind of look at the research as a whole and interpret the data. A few things that you want to be cautious of if you're thinking about doing intermittent fasting is the risk of weight loss during treatment. So one of the most important things is preventing that unintentional weight loss, that risk for losing your muscle mass that we've been talking about. So that's one thing you want to be cautious of. With intermittent fasting, it might be helpful if you're kind of in that survivorship phase. Maybe you're on maintenance therapy or you're finished with treatment and you're looking at more of a weight management approach. It might be helpful to incorporate that into your routine and kind of give your body that 12-hour or 16-hour break every night from, when we're consuming food. So it really depends on your goals and your current treatment.
I love that that you talked about that and just like the different ways, right? And what that means. And you just have to really, know yourself, first of all, what you can and can't do. But, as we think about those who were surgically moved into menopause, or they were from their chemo, now they're in menopause, or maybe they did naturally get into menopause, but throughout their cancer treatment, what are ways to eat or things to consider when trying to get some of that menopause weight off, especially for those who cannot have estrogen, like they need to have that low estrogen? What are some things that they can do? Because we consistently see, hey, with menopause, that weight gain, that middle, well, what can we do about it?
Yeah, that's a great question, and something I did not touch on when I was just talking about fasting, which brings us into this conversation. Is the other thing with fasting is we can't eat whatever we want during those 12 hours that we are eating. We do have to focus on balanced and healthy nutrition. So that's something that is a really important piece of that puzzle. With menopause, whether it's naturally or medically induced from as a result of treatment, one thing that women can do is engage in weight bearing exercises. So we know that really helps to build muscle in the body, which can burn fat and kind of helps to work against that, hormone change that we experience with menopause. So I know that SHARE offers tons and tons of exercise programs to women. So finding maybe some form of exercise program, whether it be virtual with SHARE, a walking buddy, any kind of physical activity can really help with that. Nutrition wise, it's really important to eat high fiber and high protein foods. Those are two things that can help you with weight management if that's your goal. So high fiber foods can be, primarily fruits and vegetables, but also like grains that have high fiber, cereal and breads that have a lot of fiber. Those are really going to help to support your metabolism, and then protein as well, which we talked a lot about.
Great, thank you. And so then another thing we're getting a lot of questions about is whether you have any sugar alternative recommendations, especially for coffee and tea.
Yes, that's a great question. So one way of, possibly sweetening coffee and tea when we want to avoid white sugar is to use a supernatural form of stevia. So you can use liquid stevia, which is one of the least processed forms of stevia, which is a plant-based kind of herb that is naturally sweet. So that's one recommendation. Coconut sugar is another natural sweetener. Even using a little bit of honey is certainly fine. So all ways that we can kind of sweeten foods, coffee, and teas without necessarily using white sugar.
And what about agave? Because I saw someone also had a question about that specifically.
Agave is not necessarily one of the healthiest forms of sugar. I would probably use coconut sugar, stevia, natural honey over agave.
We actually have a lot of questions about, certain medications and treatments cause diarrhea. And I know you touched on that a little bit, but, when that's like a consistent side effect, is that depleting any nutrients or I know, staying hydrated, right? Those of us who've been on chemo, we know like you got to drink so much water. But what about those nutrients? How do we get those back?
Yeah, that's a great question. You are at risk for losing some nutrients from your body, specifically electrolytes, when you have diarrhea that could potentially make you dehydrated. So eating electrolyte rich foods and drinking electrolyte rich beverages can really help to prevent that loss of nutrition if you're experiencing diarrhea. So any electrolyte drinks, even like an unsweetened type of sports drink. Coconut water has a lot of potassium, which is an important electrolyte in the body. Potassium-rich foods like bananas, which are an appropriate choice if you're having diarrhea because they're binding. So focusing on ways that you can really stay hydrated with electrolyte beverages and foods if you suffer from diarrhea.
Great, thank you. And so another hot topic is around alcohol. So how much alcohol is considered acceptable in treatment, in and after treatment for a cancer patient?
Yes. So unfortunately, there is a significant link between alcohol and many different types of cancer. So the current recommendation is that women should have 1 drink per day or less on a normal occasion. So when working with patients who are undergoing treatment, we really look at the big picture and see, is alcohol part of like your normal everyday routine? And if it's in excess of more than 1 drink on a normal occasion, it's recommended to cut back. If it's a special occasion like a holiday and you have more than 1 drink, there's certainly no reason to stress out over that. But we want to look at the big picture and see if it's part of your, normal routine in excess of more than 1 drink. Swapping that with, 1 drink and then maybe a seltzer-based beverage or a flavored water or a mocktail.
Then you mentioned earlier with Ina that it has some recipes, right? So, some of our community, they got families, and when you're trying to feed a family and then make it tasty for them, but you're also trying to make sure that you're doing everything you can, whether you're in active treatment, the maintenance treatment, or post-treatment. What are some things that we could do, or what type of recipes are on Ina so people know what to look for?
Yeah, that's a great question. So we source our recipes from 2 different main sources. The AICR, the American Institute for Cancer Research, and an organization called Cook for Your Life, which has a lot of recipes that are specifically created for people who are managing side effects during treatment. So you can ask Ina for recipes for mouth sores, diarrhea, nausea, taste aversions, and Ina will provide recipes that are appropriate for you based upon, like I said, your treatment and the side effects that you're experiencing, which can really help you to eat well if you have guidance on, oh my God, I have mouth sores and I'm scared to eat. I don't know what to eat, what's going to irritate my mouth, but I really want to make a smoothie. What should I be putting in it? And you can ask Ina and she will give you suggested recipes that come from, like I said, those cancer resources, AICR and Cook for Your Life. All of our recipes are reviewed by our team of oncology dietitians to make sure they're appropriate for the side effect that patients are asking about.
Yeah, and it looks like we're almost at time. So I think I saw one question just come in that I think would be a good place to end on is just if you could go back to the slide that shows how to access Ina, because I saw a question come in about that.
Yes, so Ina is available through our partnership with SHARE, like I said, for free to any patient, caregiver, or healthcare provider. If you go to SHARE's website and click additional resources, you can find information about Ina. This webpage will pop up and all you have to do is put in your phone number and Ina will send you a text right away so you can get started. If you'd prefer to type the URL into your browser, you can use this URL. So 2 different ways to access Ina.
Thank you so much. What an informative program. And I really loved all of the questions that we got from the community. We actually got through a lot. So we thank you.
I'm so glad.
Yeah. So thank you so much for making sure that there was time to get so many questions answered. And I want to thank all of the people who registered and who have attended live today, and those who will end up watching this on demand. We thank you so much as well. Make sure to check out SHARE's upcoming educational programs and support groups. And don't forget, follow us on social media as well. And again, we really want to thank our partnership with Savor Health. Check out Ina, y'all. You see the website up there. We'll make sure that when we send out the recording that we add the link to it from our website, and we'll send you a follow-up email once it's ready.
Yes, and we also ask that you please take a moment to fill out the survey at the end of the webinar. The survey will show up in the browser when the webinar ends, and the link will also be in a follow-up email. All surveys are anonymous, and we really use that feedback, so please fill out the survey. And that concludes today's webinar. So thank you again, everyone, for participating.
Thank you.